And welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today is Dr. Ashley Winter. She was referred by a previous guest who's been on several times that you guys say you love so much, Dr. Rachel Rubin. She is a board certified urologist in LA, and today she's going to be talking about what your cardiovascular health and sexual health maybe have in common. Please welcome her to the show. It's so nice to meet you.
It's so nice to meet you too. Thank you for having me on. And yes, any friend of my good friend Rachel's is a friend of mine.
I was
And
literally thinking the same thing, and I hear you're also friends with another fabulous urologist, Dr. Kelly Casperson, who's been on the show. Do all you awesome urologists just hang out together?
we all know each other. I mean, truly, Rachel and Kelly and I have an ongoing text chain where we just text each other all the time, every day. Did you see this new study? Did you hear about how sexual health is not being prioritized for women, and we need to do this, and we get each other all riled up, and it's great because inspiration can come in many places. And it can be from your friends and from text groups and all that good stuff. So yes, and I so appreciate you using your platform to talk about topics like this, because there is just never enough education about it, and most of us do not have enough time in our doctor's office, so we have to come prepared, when we're having an issue. So yes, thank
Yeah,
you for
I
talking
love it
about it.
because it just Dr. Rubin being on those times helps so many people start HRT, which they thought was going to give them cancer or dementia, and now they have better sexual function. They're not getting the UTIs because she's so vocal about this, and it's amazing. You three are like the Charlie's Angels of urology.
Except instead of whatever guns or whatever they use, we're just squirting estrogen at people. That's what we would be doing, and that's okay.
You're like the superheroes of that because I have a friend and I hope she's not watching, but I'm not going to say her name. And she's in her late 80s and she gets painful UTIs every single month and has to go on the antibiotics. And I said, just take the medicine. And I don't
Yes.
know why people are so afraid and so resistant.
Yeah. Yeah. I mean, this is something I will talk about every day for the rest of my life, right? We have from 30 years ago a randomized placebo-controlled trial in the most prestigious medical journal in the entire world, the New England Journal of Medicine, that showed that if you take postmenopausal women with recurrent UTIs and you give them either estrogen or placebo, the ones who are on placebo will get 12 times as many UTIs as the ones who are using estrogen. That's 12 times as many. That is just crazy. And we've known it for over 30 years, and it's safe and it's effective and it doesn't cause cancer and it doesn't cause dementia, and it's safer than antibiotics, and it's just amazing. So that is my little bullet point that I love throwing out there. I agree with you 100%. Um, Rachel
Well,
has spread that message. We will keep spreading that message.
yeah, even your Twitter, it's hilarious. It says, "Ask me about vaginal estrogen," because what's interesting to me about these people that are if people aren't getting UTIs and they don't want to take it or their sexual function, I'm not here to push this medicine. I have no skin in the game. However, the person that is getting these chronic UTIs that is afraid of taking this, but yet they're not afraid of taking the antibiotic every month, that doesn't make any sense
No,
to me because that
it
can be,
doesn't.
yeah.
Yeah, sorry to cut you off. It doesn't make any sense. And I will tell you, I have seen women who are postmenopausal who have gotten so many UTIs that they have been given so many antibiotics and they develop multi-drug resistant superbugs, right? Some of them are coming in with UTIs that are not susceptible to any antibiotics in existence, right? And if that woman gets a UTI that's not susceptible to any antibiotics and she develops a bloodstream infection from that, it is very easy to die, right? And you are entirely right. I mean, the vaginal estrogen has minimal to no systemic absorption. It has never been shown to cause cancer of any kind or blood clots ever. And yet we compare that with the risk of ending up with sepsis in a hospital. I mean, it's just wild, right? Like we have to rethink the mindset around all of that. But I know I sold you on the topic of sexual health and cardiovascular health, so I can dive into that a little bit.
Absolutely. And we can keep talking about this. I don't think people understand, though, if you don't mind, since we are talking
Oh,
about
please,
the difference
please.
between taking topical HRT, like in the form of the insert, like a Uvafem or an estrase cream, and taking it orally. Because yesterday, the doctor that was on was saying that there's risks, the increased dementia if you take it orally, but you're not talking about that.
I am not talking about that. So there are a whole variety of medications that are specifically designed to deliver estrogen or estrogen and testosterone in low doses to the vagina, the vulva, the urethra, and the bladder. And those medications, whether a low-dose vaginal estrogen cream, a low-dose vaginal estrogen insert, a DHEA insert, all of those medications do not have significant absorption into the bloodstream. And all the data shows that they don't cause dementia. They do not cause blood clots. They do not cause cancer. They do not cause strokes. But as I mentioned before, we know for a fact that in excellently designed studies, women reduce their rate of UTIs by a ratio of 12-1, which is just incredible. You know, there was actually a post, if anybody, you know, here is looking for good accounts to follow on social media, there's a book called Estrogen Matters. It's phenomenal. It was written by a oncologist who's a big advocate, so a cancer doctor who's a big advocate for estrogen use. And Estrogen Matters has an Instagram account, and they posted yesterday this great study that looked at, I believe, over 40,000 women using vaginal estrogen. And what they showed is that if you had breast cancer, regardless of estrogen receptor status, right? So you can have what's called estrogen receptor positive or estrogen receptor negative breast cancer. And regardless of the type of cancer that the women had, if they were using whether or not they were using low-dose vaginal estrogen, they had the same cancer outcomes, meaning that not only does low-dose vaginal estrogen and related products not cause breast cancer, but they're actually even safe to use in women with breast cancer, and even safe to use in women with estrogen receptor positive breast cancer, because again, these are low dose treatments. They don't raise the blood levels. They're not entering the breast tissue, right? So they can make a really meaningful impact in the quality of life of women who are receiving breast cancer treatment. So it's that safe. And I know, I mean, my best friend in the world is a breast cancer surgeon, and she lets her patients take vaginal estrogen. So I cannot even more enthusiastically talk about the safety of these type of treatments, you know, to the people who listen and follow your content.
It's not Christy Funk, is it?
Oh, no, no.
Okay, she's in LA. I was just trying to think who your best friend was being in
Oh
LA.
yeah, her name is Jamie Green. She's at City of Hope. If anybody has a new diagnosis of breast cancer and is looking for just an amazing person, an amazing surgeon, you can look her up and certainly go see her. Yeah, and tell her I sent you.
Yeah. Why are all you guys, why is Twitter your most, like, I don't really do Twitter. We're showing here, but like you and Dr. Rubin, and why is that the platform that you're most on? Because it seems like you just kind of talk to doctors on it, whereas like kind of here, you're going to get like lay people.
Yeah, you know, thankfully, I have been able to cross that divide. So I get a lot of doctors following me on social media, on Twitter, but I do have a lot of lay people following me on Twitter. I think both are super important, right? When we talk to lay people and the general public about these topics, then they're better able to advocate for themselves. But I can tell you also, I have had emergency room doctors, even infectious disease doctors, cancer doctors, orthopedic doctors tell me that they have changed their practice and prescribed vaginal estrogen because of my Twitter account. So
Nice. That's amazing.
it's amazing. I have had emergency room doctors come to me and say, all these women are postmenopausal and they come to the emergency room again and again and again with UTIs. And I talk to them about the fact that low-dose vaginal estrogen will prevent UTIs. And I started them on it. And I say, that is the coolest thing ever, because I can only see so many patients in my life. I can only write so many prescriptions, but with education, we can amplify our impact. And it's thrilling. So, those are some of the powers of, that community. I think just from a laziness standpoint, I've been very drawn to Twitter because, you can just think some random thought and type it and put it out into the world. Whereas Instagram, you're worried about making a nice template or a video or what colors you're choosing or posing for something. And it's a lot. I have to get better at doing it, but it's a lot
That's
more.
okay. I just that's not someplace I go, but I'm glad I
Yeah.
found you guys and are able to have you on my show. So I'm curious, what does your sexual health have to do with your cardiovascular health?
Yeah, I thought this would be a really interesting topic, particularly for your viewers, because I know that people who are having a plant-based and vegan diet are people who care about their health, right? And not just their sexual health, but their heart health, their cholesterol, their brain function, all the whole body, right? Because we know that plant-based diet is really good for that. And there is a really important publication called the Princeton Consensus. And it's a publication in the medical journals that comes out every number of years talking about and summarizing the evidence about the link between erectile dysfunction and cardiovascular health. But erectile dysfunction is not just a male problem, because everybody has erections, right? The clitoris gets erections. The blood vessels in your genitals are not just in your penis and your clitoris, but it's in your labia, it's in your vagina, and these are all something called arousal. So erections, clitoral erections, lubrication, all of this is about our sexual responsiveness, and all of it has to do with blood flow, and all of it is an indicator of our overall cardiovascular health. So because this new Princeton consensus came out, I just thought it would be an interesting topic to bring up. I think a lot of people don't know a lot about the link. So to dive into that a little more, right?
Did you happen to see the movie Forks Over Knives?
No.
Okay, well, it's a good one. If you can watch it, it's great.
Yeah.
It was one of the first plant-based documentaries that really got people to, go on a plant-based diet. I believe it came out in 2011. It's like 87 minutes long. Maybe it's still on Netflix. But there was a wonderful urologist that I'm not now friends with. His name is Dr. Terry Mason, and he was the chief some kind of medical officer of the Cook County Health System. And he had one of the most memorable scenes where he talked about how when you can't get an erection, what's it called?
Erectile dysfunction,
Right,
ED.
thank you. Is the canary in the coal mine. And he said that if you have cardiovascular disease anywhere, you have cardiovascular disease everywhere.
Yes, exactly. So this is the thing, right, with sexual health, whether it's our recurrent UTIs and our vaginal estrogen or our erections. So often we put those things in a little box and set it to the side and say, well, that just is my sexual life, and it's not something that's like connected to the rest of my body, right? It's not an indicator of my overall health, but that's completely wrong. It is just part of health. Now, like you mentioned, an erection, whether it's a clitoral erection, penile erection, it's just a blood flow event. And it's a very sensitive blood flow event that we can see and experience and witness. And if it's not working appropriately, as indicated by, let's say, a loss of a morning erection, a loss of a nighttime erection, this can indicate that you have cardiovascular disease, heart disease. And it's such a sensitive indicator that it predates other types of cardiovascular events by a number of 2 to 5 years on average, meaning that you could have your average guy walking around or average woman walking around, and they've never had a heart attack, they've never had a stroke, they've never been diagnosed with cardiovascular disease, chest pain, anything like that. But they started to notice that, their morning erection is not as hard as it used to be. And that reliably is an indicator that in 2 to 5 years, you could have some major cardiovascular event, right? And so this is a tremendously powerful predictor of risk and a really great way to intervene in your health, right? Talk to your doctor, go see a cardiologist, get that stress test, get that cholesterol lipid panel, right? All these things are super important. And we can only leverage that early warning sign if we're comfortable talking to our doctor about it, and if our doctor's educated and comfortable talking about it as well. So this is a really important thing to advocate for.
Nice. Did you happen to see the movie Game Changers?
No.
Oh my God.
I need to see more movies.
Well, no, these are documentaries and they're plant-based. That was produced by James Cameron, but they had a very really interesting scene where they measured erections in people that ate vegan and didn't. And guess who had better erections?
The vegans.
Absolutely. You betcha.
Yeah, I don't doubt it. I don't doubt it. Yeah, I mean, it's very good for your heart health for sure.
They actually did a similar thing with, there's a new documentary on Netflix called, I forget what it's called. I just watched it. The study of twins where one goes vegan and one didn't. And they measured their arousal too. And apparently the plant-based diet is good for sexual health.
I don't doubt it at all. I mean, also, something that's bad for sexual health is inflammation, right? So we also know that animal-based products are associated with higher levels of inflammation in the body. And so, there's also that component of things. Yeah,
in your bio that you gave me, you said you're working on a device for women's sexual health. What is that?
Oh, yes, this is something so I am a medical advisor for this company called FirmTech. You can look it up, myfirmtech.com. They make, I hate this word cock ring, but they make cock rings. I like technically it's a penile constriction device, aka cock ring. And they make smart cock rings even, right? So they make cock rings that if you wear it, it can tell you how long your erection was and how hard your erection was, right? So it's a really cool way to be proactive about your health because you could even wear it overnight. So like you're saying, maybe you're considering going on a plant-based diet, and if you had this type of device, you could wear this device and say, oh, are my nighttime erections harder and longer lasting and more frequent once I start my plant-based diet, right? Which I suspect would be true. Or if I have sleep apnea and I start using my sleep apnea machine, well, my erections get better, right? This is something you'll be able to see. And that's very exciting because, again, erections and sexual function are a window into our overall health. Now, another thing that I'm working with this company on is developing a clitoral sensor because we want equity. We want to be able to break down our understanding of clitoral function as well, see the function of that clitoral erection, and get insights into our arousal. So we have a prototype right now. It's like a little egg. It goes in the vagina and there's a little piece that goes forward and a sensor that sits in front of the clitoris and tells you about your clitoral pulse amplitude in response to arousal. It's not on the market yet. PSA, if anybody is interested in collaborating with us or testing our device or donating to our nonprofit that does research about women's arousal, or you want to invest in the company, you can contact me. I'm Ashley, ASHLEY, at myfirmtech.com. That's my email. Yeah, and I'm just so excited that there is a company that actually cares about this because I think it's amazing. And people say to me all the time, well, can't you just tell if you're aroused? And I say, have you ever told somebody with a penis to not look at their penis and just feel if they're aroused? Like, they get to look at it, right? We deserve more insights into our arousal and what makes us have a healthy genital response. So yeah, I would love if you have any questions about that. I would love to talk more about it, but yeah.
Yeah. Do you have, what does it look like? Do you have one with you?
I don't have one with me. I wish I did.
You
But I
probably
have personally tried it. So
Oh my God, you
yeah,
probably can't really like show it, like put it on during, I don't think YouTube would.
no. No, but I participated in our first clinical trial, and it was so funny because what you had to do was wear the device and then look at non-arousing material and see your clitoral pulse amplitude, and then look at arousing material and look at your clitoral pulse amplitude. And the non-arousing material was a video of the Minions, you know, like the cartoon with those little guys. And so I'm sitting there wearing this sensor on my clitoris and watching a cartoon video of the Minions, and I'm like, this is
Oh my,
ruined.
yeah, that would be
This is
something.
ruined.
If you
Video.
showed arousal on that, I don't know, that might be.
I didn't.
How
Thankfully.
how will this device and where will people get this? How much will it cost and how will it help people?
Yeah, this is a great question. So it's not on the market yet. I don't even have an estimate on how much it would cost. We're trying out different types of sensors. So we're probably, you know, a year plus of research before we get something to market. In terms of how it will help people, I think there's so many different ways, right? So again, there can be the way you use it as an insight into your overall health. Like you put it on overnight and you look at your nocturnal clitoral erections and you say, what lifestyle interventions can I do to improve the quality of my nighttime erections, of my clitoris, right? Whether that's switching to a plant-based diet, whether it's cutting out alcohol, whether it's exercising more, whether it's a change in your medications, right? Like this is another insight into your overall health. So that's one potential way. I think another way would be sexual biofeedback, right? So there are people who, based on a history of trauma, have difficulty becoming aroused, have difficulty obtaining orgasm. And you can use something like this in real time to say, what things stimulate me? How is my body reacting to this? Am I putting up cognitive barriers to, you know, entering and into my arousal and sitting with my arousal? So there's that component. You know, on the other spectrum of things, I think there might be people who use it as a sex toy, as a, you know, kink play. You know, maybe you wear it and your partner spanks you and you're like, oh, I can see that I'm getting aroused, you know, like
Oh,
I don't know. That's, you know, that per se is not my explicit area of expertise, but the sky is the limit, and we won't know how many types of insights we can get with this sort of device until it exists, right? I mean, how many people 20 years ago would have said, what's the point of wearing a you know, a Fitbit? Like, what's the point of that, right? Don't you know when you sleep? Don't you know when your heart rate's fast? And yet we know for a fact that it's provided so many insights to so many people about the way they live their lives. So yeah, great question.
all right. Well, great. Well, speaking of questions, we had viewers that sent in questions in advance. And after we get to these guys, if you want to post them, we're now streaming on Instagram. You can post there and also on YouTube, of course. Facebook, if you're watching there, best to go on YouTube because we can't see as many screens as we have platforms. So the first one is from, who's it from? Diane. Dr. Winters, could you discuss vulvar lichen sclerosis?
Yeah, I love this topic. So this person might be asking it because yesterday was International Lichen Sclerosis Awareness Day. And I posted a video about it and was talking about it. So lichen sclerosis is an inflammatory condition of your genitals. It can happen in men, it can happen in women, it can happen to anyone. Mostly affects people who are younger than puberty, so kids, and then also women after menopause. And the typical symptoms are and signs are shiny white changes to the skin of the labia, particularly, or the foreskin around the penis. It can also affect around the anus, and you can have pain, you can have itching. It can completely cause the labia to fuse, making it impossible to have sex, making it so that you cannot feel your clitoris. For if you're in a man, making it impossible to urinate because your foreskin is completely fused. It's a big deal, right? If it progresses, that's a big deal. Um, and a lot of people do not get treatment for it, right? I think a huge reason, this is something I was talking about in my video yesterday, is because a lot of women after menopause stop going to the gynecologist, right? They're told, oh, you're done with your childbearing, you don't need to go to a gynecologist anymore. And their internist doesn't necessarily do a genital exam, right? And I internists are amazing people. They have way too much on their plate. I understand why it doesn't happen, but this is a reason why this type of condition falls through the cracks, right? And a woman says, oh, my genitals itch, my labia itch, and they're told maybe they have a yeast infection or something, right? Put on some over-the-counter cream for antifungal. But the problem is that's not an effective treatment for this condition. This condition really needs a combination of two things. One, a steroid on the outside on your labia, a pretty high dose steroid most of the time, something called clobetasol. And then two, actually a vaginal estrogen or related product like intravaginal DHEA, et cetera. So again, another use for vaginal estrogen in addition to UTI prevention. Love it. And so important to know, this condition, if you leave it alone and don't ever treat it, it actually can progress into vulvar cancer, okay? And vulvar cancer is a nasty disease. I mean, you can have to have your vulva removed, right?
Oh
Like your
my
labia
gosh.
cut off. Yes. Oh my gosh. And this is something that can oftentimes be prevented using a steroid cream, okay, with appropriate diagnosis. So this is a cancer most women have never heard of, or most men have never heard of, because penile cancer too. And it is treatable, it is preventable, and people do not have to suffer. And there is so little awareness. I can tell you another thing that drives me crazy, okay? If you look up lichen sclerosis online, the top probably 20 hits you get, Medline, Wikipedia, whatever it is, they will say it is a rare condition. I can tell you for a fact it is not a rare condition. I see it all the time. A pathologist friend of mine who looks at the slides from the biopsies says it's not a rare condition. But because we don't talk about it, because people don't seek help for it, because it's underreported, it's considered a rare condition. And to me, that's tragic, right? It is tragic. So that is lichen sclerosis. That's my short little spiel on it. And the last thing I wanted to say here, the last thing, go on. Please look at your genitals. Just get a mirror, look at your genitals, get acquainted with your vulva, your labia, your anus, your penis, right? Though usually it's easier to look at penises, but and know what's normal for you, right? Know what's normal. So if you start experiencing a change and experiencing symptoms, you can advocate for yourself, right? It's just part of your body. So
Thank you. Yeah, interesting. So that they actually have a day for it, you know?
I know. I didn't even know that, again, because of social media. And I'm so glad that somebody notified me on social media that it was Lichen Sclerosis Awareness Day, because I talked about it. And a ton of people come out of the woodwork saying, you know, my mom died of vulvar cancer. She had lichen sclerosis. It was undiagnosed for 20 years. Or I have lichen sclerosis and it took me 10, 15 years to get a diagnosis. Or someone saying, you know, I think I might have this and I didn't know what it was. And because you're talking about this, I'm going to seek out help. And again, another power of social media to do something really good and normalize sexual health, genital health. So yay, World Lichen Sclerosis Awareness Day.
Thank you.
Yay.
Okay, so this is a question from Laura, and she says, Dr. Winter, can you please explain why women have vaginal dryness after menopause, even if they're on the vaginal estrogen cream twice a week, and why we no longer have the surge of fluids during foreplay? What do you suggest is the best replacement for this?
Oh, this is a great question. Okay. So there's so many layers to this question. I love this question. Okay. So female arousal is two main things, right? It's getting a clitoral erection, which helps with your clitoral sensitivity and orgasm. And it's also becoming lubricated. So that means developing fluid that comes out of your vulva, your vulvar vestibule. There's little glands there. That's the area right out at the opening of your vagina, and then deeper inside your vagina, also getting wet from your actual vaginal wall. And both getting wet and both erections happen because you get increased blood flow to your genitals in response to stimulation, sexy thoughts, whatever. Okay, that is arousal. Now, in order to have that response to get wet, to get lubricated, to not have that dryness, both in response to sexual stimulation and also all the time, right? Like you're just sitting doing working on your taxes, I don't know, and you don't want to have a paper dry vagina, right? That sucks. You have to have healthy blood vessels. And to have healthy blood vessels, you need enough estrogen. And one of the first line treatments for that is something like this vaginal estrogen that your listener is using twice a week. Okay, absolutely essential. Now, just because you are using it twice a week doesn't mean it's enough for you. Okay, this is something I see time and time and time again. Okay, if you had high blood pressure and you took a blood pressure pill, would your doctor just send you on your way and say, you had high blood pressure, but I put you on your blood pressure pill, so now your blood pressure is fixed? No. You would be put on the blood pressure pill. Your doctor would recheck your blood pressure on the blood pressure pill and make sure that your blood pressure was normal, right? And if it wasn't, if it was still high, they would give you more of that blood pressure pill, right? We don't do this for treating low estrogen in the vagina and vulva. We just don't do it. Most people have these symptoms. They have menopause. They have low estrogen. They're given estrogen cream twice a week and told, your problem is now solved. Now, what I see in my practice is somebody comes in, they've been using it twice a week for 3 months, which is as long as you need to be on it for to be completely effective. They've been using it twice a week religiously for 3 months, and they come in, and some people are perfect. The tissue is well estrogenized. They're not dry. They're responding to sexual stimulation. Hunky-dory, amazing, goodbye. Then there's someone else who comes in and they've been doing the exact same thing for 3 months, and they still have paleness of the tissue. They still have atrophy or narrowing of the opening of the vagina. The tissue's still dry. The blood vessels are not well estrogenized. They cannot respond to sexual stimulation. They cannot be well lubricated. Okay, that person probably needs to use more. They probably need to be trying it 3 times a week. Okay, it is important to know that when we talk about safety data for low dose vaginal estrogen, we're talking about it in context of the recommended dose. So let's say 2 times a week. So if you're using it much more than twice a week, you do need to monitor your symptoms. You do need to talk to your doctor if you're experiencing any, increased absorption, like breast tenderness, anything like that. Although it's extremely uncommon. And if you're even just say using it 3 times a week, it's extremely, extremely, extremely unlikely that you're going to have any increased risk. So that's my first comment there, right? That this person just might need more. And you have to understand that people are different, right? Not every, different vulvas have different, and different vaginas have different sensitivity to estrogen. Okay. Now, the other missing part of the equation here is testosterone. So testosterone is super important for vaginal lubrication, for vulvar lubrication, for sexual responsiveness, to overall health of your bladder, urethra, vagina. It's awesome and important. Every woman has it, every man has it, blah, blah, blah. So if your symptoms are not adequately resolved with using your low-dose vaginal estrogen, a huge thing to consider is something that has a testosterone component. So the easiest way to achieve that is to use something called Intrarosa. It's intravaginal DHEA. It has both a testosterone component and an estrogen component. And there are plenty of women who still have dryness with their low-dose vaginal estrogen. If they switch to the DHEA, they're gonna have resolution of their symptoms. You can also find a specialist who will prescribe both estrogen and testosterone compounded low-dose gel or cream. This is something I use frequently in my practice. It's something Rachel Rubin prescribes frequently in her practice. It is a game changer. So to the person who asked this question, I'm sorry you're having ongoing symptoms of dryness and discomfort and lack of arousal with your low-dose estrogen. You do have options. You can try increasing the dose, or you can try something with testosterone. Very long answer, but there you go.
Thank you. Thank you so much. One of the viewers on Instagram is saying that his wife was told to use coconut oil as a lubricant and it works great. Is that safe down there?
Yeah, coconut oil is great as a lubricant. You know, there are certain things you have to be careful, right? So if you're trying to get pregnant, you don't want to use that because it can interfere with the sperm. But that doesn't mean it's unsafe. It's just like if you're actively trying to conceive, don't use that. There are great lubricants that are fertility friendly, like pre-seed. You can look that up. I don't have any relationship with that company. And then you also just have to be careful using oil-based lubricants with things like condoms. So on the other side, if you don't want to get pregnant, oil-based lubricants can make a condom break, for example. So you want to use something like a water-based lubricant, but it's safe, it's awesome. You know, many people use it just to make sure to use it. It's obviously here with our plant-based diet. We love coconut products, but keep a separate jar of coconut oil in your kitchen and a separate one in your
Yes,
bedroom. So you
please don't bake with the one that you're putting there.
Yeah,
Sure,
yeah, like your friends will not appreciate your lube, your lube going into the brownies or
oh
whatever.
my God, that's hilarious. That's hilarious.
So
Here's an interesting question from a live viewer named Connie. Do you recommend estrogen for postmenopausal women who don't have any issues?
I love this question. So again, we can talk about different types of estrogen, right? There's the low-dose vaginal estrogen that we use for UTIs, etc. I personally think we should educate and offer it to every single woman, even if she has zero symptoms. And the reason I think that is because it can prevent UTIs. And those UTIs can start when you're 50, 60, 70, 80, 90. Why wait till you're whatever age they start and miserable for this to become a problem if you could prevent it with something that is a very low risk? Again, not that you have to, it's everybody's body, everybody's choice, but I think it's something to consider and it's an option, right? We talk about preventative care for other body parts, right? You don't wait to get a cavity to brush your teeth, right? This is, in my opinion, not very different. Now, the other type of estrogens we could talk about are things like hormone replacement therapy. So systemic estrogen pills by mouth or patches, right? I'm not a huge fan of taking it by mouth, but there are people who use, let's say, transdermal patches, right? Much more complex issue, but it is important to know that systemic estrogen is FDA approved for the prevention of menopause-related osteoporosis, okay? Because it prevents loss of bone density. So you could be someone walking around, you have no hot flashes, you have no night sweats, you have no other menopause symptoms, you have no menopause symptoms whatsoever. It is still FDA approved for you just to prevent osteoporosis from happening. So actually, even if you have no symptoms whatsoever anywhere in your body, zero, there is still a FDA approved reason to take it if you decide that's important to you. Again, not pushing it on anyone. You can make your own decisions, but yes, there is a role for it in either instance, and it's definitely worth something considering and talking to your doctor about and making a decision that's right for you.
Right. Thank you. Just to play devil's advocate, are there any contraindications to using vaginal estrogen, or is there any downside in even some people?
This is a great question. There, I mean, if you are actively receiving estrogen suppressing therapy for breast cancer, I tell people to have their oncologist clear them for it. But as I even mentioned earlier in this program, there was a study that just came out looking at over 40,000 women, showing that even if you have breast cancer, estrogen receptor positive, that it doesn't lead to worse outcomes. So it's really hard to say there's a true contraindication or true reason you can't take it. Yeah, I'm so hard pressed to say that.
Yeah.
Really, I mean, yeah, I'm so hard pressed. There are people who will have an allergy to a component of it, right? And they take it and maybe they get a rash, swelling, etc. That would be a contraindication to the type of formulation. And usually it's a reaction to the preservatives in it, not the estrogen itself. So if you take it and you get a rash, have some bad reaction, wheezing, etc., really talk to your doctor about getting a compounded version of estrogen, because you can get preservative-free, really simple inert base. Your body's not allergic to estrogen. You have estrogen in your body, right? You're allergic to a preservative. So, yeah.
Right. So maybe is there a difference between like the pill and the creams, or is it just a user preference?
Yeah, so that's a great question. So in terms of estrogens that raise your blood estrogen level, not the vaginal preparations, but things that are called menopause hormone therapy that are meant to raise blood estrogen levels, there are different types. There's pills, there are patches and gels. Generally, the patches and gels are considered safer because the way they're metabolized by the body, they do not increase the risk of blood clots. Whereas oral estrogens are associated with an increased risk of blood clots. And oral estrogens, even in birth control pills, are associated with an increased risk of blood clots, which is important to know, especially as you get older, because there are women who are taking birth control for treatment of menopause symptoms in their, 40s, let's say, or perimenopause symptoms, and they have an increased risk of blood clots. And actually, they could be switched to an estrogen gel or an estrogen patch and have lower risks, right? And a lot of people don't know that. So that's important to bear in mind. So of course, that's important. Now, another reason you can't take estrogen would be if you have a uterus, you still have your uterus, you haven't had a hysterectomy, you must take some type of progestin with the estrogen. Not vaginal estrogen, but systemic estrogen. And that's because if you're taking something that raises your blood level of estrogen without progesterone, your endometrial lining, so the lining of your uterus, can get thick, and that can lead to endometrial cancer. Not breast cancer, but endometrial cancer. So that is important to know. Yeah. And then this is a whole nother thing, but in studies, most of the risks, like in the WHI study, most of the risks were not associated with the estrogen itself, but actually with something called a synthetic type of progestin, called medroxyprogesterone, which is a complicated medication. I would rarely prescribe it myself. You can prescribe different types of progestins, such as micronized progesterone, which is considered the bioidentical type. Yada yada. Long digression.
You mentioned birth control pills. Most of my audience is just historically older, but and they're probably not on them anymore, most of them. But you mentioned there are some risks to birth control pills, though.
Oh, yeah. I mean, birth control pills, I have lots of complicated feelings about. I am a huge fan of contraception. It does liberate women. It gives us more options. It gives us control over when and how we build a family. But in general, women are not educated enough about the risks. So again, oral birth control pills can increase the risk of blood clots. Also, particularly combined oral contraceptive pills, which are a combination of a progestin, so a synthetic type of progesterone, and an estrogen called ethinyl estradiol, they can really affect your sexual function through a number of ways. So number one, the really low dose types of oral contraceptives can actually lower the amount of estrogen in your body. Okay, you might say, that's crazy. I'm taking a hormone. How do I end up with less estrogen in my body from taking a hormone, right? And the reason is this. So you take it, it suppresses estrogen production by your ovary. And the amount in those ultra low dose contraceptive pills is not enough to make up for what your ovary would have produced. Okay. So you actually end up with this level of estrogen that's less than your body was producing on average. And that can cause a lot of the same symptoms we were talking about: vaginal dryness, reduced lubrication, UTIs. Okay. It's crazy. And you have women who are put on this at 13 years of age, right? They don't even know that the way they're living, that the symptoms they're experiencing is a direct consequence of the pill they're on. Now, the other things that it does, really important, is it affects the level of testosterone in your body. A number of ways. The first way is that this oral estrogen raises a molecule in your bloodstream. I'm getting jargony. It raises a molecule in your bloodstream called SHBG, and that binds testosterone in your bloodstream. So it makes the amount of available available testosterone in your body less. Okay. 100% of people taking a combined oral contraceptive pill will have lower bioavailable testosterone. 100% all the time. Always. Whether you have symptoms from that or not is variable. Now, the other way it affects testosterone is by the type of synthetic progestin. Okay, so some synthetic progestins are what we call anti-androgens, meaning they directly counteract the effect of testosterone. A common one is something called spironolactone. So the point being, to sum up all my jargon, oral contraceptive pills, particularly the ultra low dose ones, can lower your estrogen levels, can lower your testosterone levels. This can have really important impacts on vaginal health, vulvar health, bladder health, libido, lubrication, you name it, right? It is crazy. It is crazy. And so for your listeners, whether it gives them insight into their own life in the past, into their own life now, into the life of a loved one, a friend, a daughter, these are important conversations to have. And again, I'm a huge fan of contraceptives, but we really need to be aware of the way it affects our body so we can be educated if we are experiencing something that's not good, right? Yeah. I think maybe you're frozen for me. Oh no.
My gosh, guys, I'm so sorry. I don't know what happened, but if you can see me now, if you can hear me now, let me know in the chat. Wow. Hi, Dr.
Oh,
Winter. So sorry.
hi.
I
Yeah.
don't, thank God we're back. Thank you, Charles.
Yeah.
We're using an external system now. That happens not very often in 2000 shows, so I apologize. I might
No
lose
worries.
chat. So I was asking you a question about Yanni eggs, and that's when I believe I froze or you froze. Did you hear the question from Deborah about what do you
Oh, no,
think?
I didn't. I
A Yanni egg to strengthen the pelvic floor muscles.
don't know what a Yanni egg is. Is that like here, I'm looking this up. Oh, okay. Oh, interesting. Yeah, I'd be interested in knowing why they specifically want to strengthen their pelvic floor. So what this person's talking about is kind of a weighted egg-shaped object that you're putting in your vagina, and I think the idea would be that you're squeezing your pelvic floor to prevent it from from dropping out. Now, if you're interested specifically, let's say in strengthening your pelvic floor because you're experiencing urinary incontinence, my first enthusiastic recommendation would be that you go see a pelvic floor physical therapist, even just once. They will give you all the tools, all the recommendations on how to do pelvic floor exercises the best way, right? Because there are people, understandably so, who don't do pelvic floor exercises or Kegel exercises or use an egg the right way. And if you do it the wrong way, you could end up with things like overactive bladder, painless sex, what we call a hypertonic pelvic floor, right? So even just that one consultation could be amazing. I say, like, you know, if you don't, I don't know how to lift weights and you have someone teach you how to do it the right way, that's like a really important tool, right? And why would we treat the muscles in our pelvic floor that differently? So, you know, I don't personally have a really robust thought on those eggs themselves, but just really hone in on why do you want the eggs? What are you trying to achieve? And if you have a specific concern like urinary incontinence, you know, really consider talking to a pelvic floor physical therapist and make an appointment with one, even if it's just one time. They're such a tremendous resource.
They're fabulous. I've had several on the show. Their names are Mandy and Julie, and we've done quite a few episodes, and they can do all kinds of things, even help with constipation. So yeah, they're great. I think they're amazing what they do. So here's a question. Actually, there's one more that was submitted that I really should get to first. People are asking where you practice, and it is Los Angeles.
Yes.
Yeah. Okay. So let me get to the one that Mona sent in because it's time to do that. She says, besides drinking plenty of water and having cranberries, I'm 68 and I'm not sexually active. So how do I prevent 1 to 2 times a year bout with UTIs? Estrogen.
Yeah, you know already, estrogen. This is a thing, right? Your vagina is important, even if you're not sexually active. Okay, everyone, it contains, right? When you have the estrogen, that helps the healthy bacteria called lactobacillus live in your vagina. And those are your defense. They are the warriors. They fight off the bad bacteria like E. coli from getting inside your urethra. Okay, your vagina is important no matter how much sex you have or don't have. And it is your body's defense against UTIs. Give it the estrogen.
Thank you. Okay,
Yes.
so this is great. This is an interesting question from Dana. She says, can you explain what actually happens clinically in the vagina and clitoral tissues when somebody is on a non-health promoting diet, like the standard American diet?
Yeah, I mean, it depends person to person. I think it ties into a few different factors, right? So if you, let's say, are on a standard American diet and you have too much saturated fats, right? Not enough fiber, you know, not enough antioxidants, you know, then you're just at a much higher risk for cardiovascular disease, right? And that leads to unhealthy blood vessels. It leads to decreased responsiveness to sexual stimulation, decreased lubrication, decreased health of the tissue. Again, you know, there's a spectrum of this effect, right? Like, yes, if you go out and have one unhealthy meal, is there going to be a change in your vulva and your clitoris? Absolutely not. But if you have a lifetime of unhealthy eating with pro-inflammatory factors and you develop cardiovascular disease, then that can have a direct impact on your genitals, right? So it's really just about, like, okay, people make mistakes with their diet. I do it all the time personally, but what's the long game here, right? And the long game of healthy eating and plant-based diets are definitely very good for your sex life and your genitals. And also minimizing alcohol if you can.
Oh yeah, absolutely.
Yes.
Okay, Rich is asking, why do they tell men not to use gels that have testosterone in them that are put on the skin as opposed to taking a shot because supposedly they will have bad effects?
So, I think what this person is asking about is something called transference. So if you have low testosterone, there are a bunch of different ways to take it. The most common ways to take it are through a gel that you put on your skin or with an injection. One of the things that people don't like about the gels is a property called transference, which means if I put a testosterone gel on in the morning and I touch a family member, it can get on them and it can change their testosterone levels, right? So there have been reported cases. Let's say you have some guy, he's 45, he has low testosterone, and he starts taking this and he has a 5-year-old kid, and the kid ends up getting signs of early puberty, right? Suddenly gets like penile enlargement, a facial hair, like stuff that's you don't want to happen to a little kid, right? So it is a real concern. And if you have women and younger children in the household, you have to be really aware of that and make sure that you're putting it on a part of your body that is not going to come in contact with other people. And after you apply it, that you wash your hands really well. But no, I mean, they're great medications. You just have to know about that and be careful about it. It's neither here nor there. You can inject testosterone, you can use a gel. However you get to the testosterone level that's healthy, that it gets rid of your symptoms, that's the important thing. So yeah.
Thank you. Marley says, is oral HRT a contraindication for women with cardiac genetic variant that could increase the risk of clots, such as LP little a? And maybe you could say, why are some women taking oral versus topical?
Yeah. So I mean, you know, some women are using oral estrogens. I mean, overall, for many people, they are safe. They're easy to use. Another reason you can be on it, for example, is that there's shortages right now of a lot of estrogen patches, right? And maybe you don't want your horrible symptoms to come back while waiting to get your patch. So there are a variety of reasons why somebody might consider using an oral estrogen. Again, from large randomized trials, we know that the transdermal preparations, meaning the patches and the gels of estrogen, have never been associated with an increased risk of blood clots, but the oral ones are. So I'm not super familiar with this person's specific family risk factor, but when I have anybody cross my door who has a higher risk of blood clots, I would strongly recommend and advocate for use of that patch or that gel as a first line, because it's just not going to increase that risk. And I mean, I feel so strongly about that if you have somebody who's, you know, taking aspirin or a blood thinner for a blood clot, I feel comfortable giving them an estrogen patch or a gel. That's how strongly I feel about its safety. So yeah.
Thanks. Jennifer, who's watching live, says, is it beneficial to use both vaginal cream that you're speaking of and hormone cream on the arm made in a compounding pharmacy and oral progesterone, especially if someone has osteoporosis? What's the pros and cons?
This is a great question. So there are many women who are using what's called HRT or menopause hormone therapy to raise their blood levels of estrogen and progesterone who still have vaginal and vulvar symptoms. Okay, we know for a fact that what's considered this HRT does not have the same efficacy in reducing urinary tract infections as vaginal estrogen does. It just doesn't. Okay, so oftentimes women are told, oh, you're taking HRT, you're taking an estrogen patch, you're taking an estrogen gel, you're taking an estrogen tablet by mouth. You don't need vaginal estrogen. Why would you need 2 types? But that's wrong, because the data shows it's just not as effective in preventing UTIs. And the vaginal preparation, because it doesn't raise blood estrogen levels, is safe to take at the same time as another type of estrogen. It's completely okay. It's completely safe, and there are added benefits. I know for a fact when I enter peri and post-menopause, I plan to use an HRT patch or gel, and I also plan to use a vaginal estrogen, and I will probably use both of those forever until I die and be buried with it. And in full transparency, that's how strongly I feel about the safety and the importance of both of those. You know, in terms of your comment about progesterone, there's different reasons to use progesterone. Again, if you're using HRT and you have a uterus, you must be on a progesterone of some kind or progestin of some kind to prevent endometrial cancer. If you have had a hysterectomy and you do not have a uterus, you do not have to be on it. But many people still take it because it can help with symptoms like anxiety and quality of sleep. So there is a very reasonable regimen where you're using a progesterone, where you're using an estrogen patch or gel and a vaginal estrogen. So you can use all of those together. It's a wonderful combination.
Thanks. Patty's saying, so I'm still menstruating and on birth control pills. Am I possibly not experiencing the menopausal loss of my period because I'm taking the pill? I'm experiencing other menopausal symptoms.
Perimenopause can cause, well, I'd be interested in knowing how old this person is. You know, like I said, I mean, some people have such a severe ramification of being on ultra low dose contraceptives that they have menopause-like symptoms that is caused by the pill, right? And not that they're in perimenopause. There are other women who are in perimenopause and are put on the pill, but it's not the best option for them. So, you know, if this person, let's say, is in their 40s, they're experiencing symptoms that they think are perimenopause, and the oral contraceptive pill is not adequately treating those symptoms, I would really suggest that they talk to their doctor about stopping the pill and being put on some type of HRT, right? Estrogen plus or minus progesterone as a treatment for those symptoms, because a lot of times that's going to give them a better profile of response. Now, you can still get pregnant when you are perimenopausal, right? This is important to note. So if you still need birth control, there are options, right? You can use an IUD and you can take your estrogen and be perimenopausal. You can take your estrogen and use condoms, and you know, there's all different options, but you don't have to think that symptoms of menopause or perimenopause while you're on the pill or something you just have to suffer with.
Thank you. I think Angie must have tuned in late because she's asking, with estrogen, is there a concern about it being carcinogenic and how much is too much?
Yeah, great question. So the vaginal estrogen, no, it's not considered carcinogenic. Again, you know, we consider it low dose when you follow the manufacturer guidelines. So you're talking about 1 gram twice a week of the 0.01% estradiol, for example, but you can definitely increase that slightly with your doctor's guidance. When you're talking about systemic HRT, so pills, gels, patches, estrogen in the Women's Health Initiative study, which is the biggest study that's ever been done on this topic, randomized, cost $1 billion, media frenzy, estrogen itself was not associated with breast cancer. It was not. It was not associated with any type of cancer at all. The only type of cancer it would be associated with is endometrial cancer if you are not using a type of progesterone, okay? Now, all of the increased cancer risk that has been reported has been associated with the use of a synthetic type of progesterone called medroxyprogesterone. But you can use oral micronized progesterone, which is considered bioidentical progesterone, and that has not been associated with an increased risk of breast cancer. So to answer this in a very long way, estrogen is not associated with getting cancers. Now, you might say to me, but doc, I have estrogen receptor positive breast cancer. Doesn't that mean that estrogen causes breast cancer, right? This is a great question. This is the important thing to understand about cancer biology. What it means when you have an estrogen receptor positive breast cancer doesn't mean that estrogen caused your breast cancer. It means that you have a cancer cell that expresses a receptor for estrogen, which is the type, which is a normal thing for a breast cell to do, okay? When you lose that estrogen receptor, it means that your breast cancer has mutated so much it no longer expresses that estrogen receptor. So when the cancer has that estrogen receptor, we leverage that, right? And we reduce your estrogen levels to try to get rid of that cancer. But it doesn't mean that estrogen caused that cancer. Does that make sense?
Yeah.
Yeah, it's a difference between treatment for a cancer you have and cause. Okay. You know, yes, yes. I could go on about this forever, but estrogen receptor positive does not mean estrogen caused your breast cancer. We just, yes, we need to
Thank you.
liberate ourselves from this fear.
Thank you. Randy
Mhm.
says, why is it that women always are portrayed having little or no sexual desire as opposed to men as we age?
Well, this is a great question. I mean, I think a lot of that is untreated menopause, and we don't give people the resources, right? So, you know, you could have desire for sex, but if you have severe genitourinary syndrome of menopause and you have no lubrication, you can't get lubricated no matter how turned on you are, your vagina is tight, sex is painful, that makes you not want to have sex, right? So even if you're like in the corners of your brain, you are the horniest person on the planet, if your body doesn't allow you to have pain-free sex, if your body does not allow you to become engorged, wet, sensitive in response to that feeling in your brain because your hormones are low, then that's gonna take it away from you, right? And I think over time, so many women, so many couples suffer because we don't use the hormonal tools to allow people to have pain-free sex, to allow people to connect their brain with their body, right? I truly do not believe it is an inherent difference based on gender. I think it's about allowing our bodies to do what our inner sexual being wants, right? I mean, women read lots of like sexy books, women love porn. I mean, all the data shows that. Like, allow them to live their best sexual life. And I can tell you, when you treat a woman, when you treat their menopause, when you treat their low sexual desire disorder, which there are FDA approved medications for, there are many treatment options for. When you do all of that, there are people who have amazing sex lives at every single age. Okay. And then I should also say, of course, sex is not just about penetration, right? There's non-penetrative sex, there's solo sex, there's vibrators for sex. There's so many different things, and people have erotic lives no matter what their body are doing. And we have to give people the tools, and we also have to educate people about normalizing all sorts of pleasure.
Thanks so much. This is
Yeah.
about bone health. Does HRT patch therapy help for bone health? Asks Marley.
Yes. Yes. The answer is yes. Again, it is estrogen menopause hormone therapy with a patch. Estrogen is approved, FDA approved for prevention of osteoporosis due to menopause. And I will tell you, I'd like to share this story. My grandmother lived till 97. She lived independently till 97. She fell when she was 95. She did not break a single bone in her body, and she was taking estrogen for almost 50 years.
Wow.
I know. And she didn't have a bent spine. She didn't break a single bone. She didn't have any of this stuff. And that's so important, right? Because as you age, bone density has an incredible impact on your quality of life, on your fragility, on your ability to exercise, on your ability to travel, on your health and wellness, right? On your risk of dying. Women who break their hip in later decades of life have a very high risk of dying afterwards or within the year after that hip fracture. Okay. This is so important, and it is the most effective thing you can do. And unfortunately, once you stop that estrogen, your risk of osteoporosis goes back up. So a lot of women are told to take estrogen for the shortest amount of time possible for their hot flashes. But what about being on it for the longest time possible for prevention of osteoporosis, right? I mean, that's another way we could be thinking about this discussion.
Thank you. Let's see what we got here. Okay, so I was delaying this question because it's from Fran because it's so long. So I'm going to try to, um, what I can't speak today, shorten it. So basically,
Yeah.
her question is that she was diagnosed with interstitial cystitis, but she didn't have it. She had basically just a UTI, but she had an arrogant doctor who just, tested the urine in the office and then treated her for months with these bladder treatments. And and then when she got a better doctor, he said, no, you need a culture. So she had basically a raging UTI for like
Oh.
100 days. And this doctor was giving her these bladder installations every month, and she never had UTI. So, she never had interstitial cystitis. And so the question is how do you get a doctor to believe you when you have a UTI, even if it doesn't show up? Because is that little sticky thing when they test in the office as accurate as actually growing the culture out for days? Because apparently if he had done that, which the next doctor she saw, which she couldn't get in to see for 3 months did, once she got an antibiotic, she was better. And she suffered with all these, treatment of a disease she didn't have.
Yeah, this is a great question. Yeah, I mean, there are definitely reasons why somebody could have a positive urine culture and a negative urine dipstick. There are certain types of bacteria that are associated with that. Okay, like for example, something called Enterococcus. I will frequently see patients with a negative urine dip test and a positive culture for Enterococcus. That's one example. The most important thing is treating a combination of the test results and symptoms, right? So there are people out there walking around with something called asymptomatic bacteria, which means they have bacteria sitting in their bladder and they don't have an infection, okay? There are other people walking around and maybe they have a negative urine analysis, but a positive culture, and they have bad symptoms, such as your listener, and those are people you treat. So you have to kind of aggregate all that information. If somebody came to my office and was experiencing these debilitating symptoms that seem like an infection, we definitely send a culture. That is an important thing to do. So, yeah, I wish that would answer the question better, but it is important when somebody has symptoms, and potentially findings of inflammation in their bladder on an exam to do a culture to look for an infection. Yeah.
Right. Well, that's an unfortunate experience that she suffered. Did
Yeah.
to know that having bladder installations when she didn't have this disease, did that do any harm to her?
That's a good question. I'd say it's probably unlikely, other than the direct trauma of having something, to do these installations, somebody has to have a catheter put up their urethra and medication instilled in their bladder. And of course, if you're experiencing an infection, the tissue is very inflamed and irritated, and it can just be traumatic to go through that experience. But in terms of causing a direct damage, it's very unlikely that that would be the case.
Are there any problems with having an untreated UTI for 100 days like that?
Oh, I mean, usually the dangerous consequences of an untreated UTI would be manifest during that time, right? Like it would become a bloodstream infection called sepsis, right? Or it would become an infection that enters into the kidney. That's called pyelonephritis. It could be associated with development of a kidney stone, which would obviously be a problem. But if this person has gotten through that time period and has gotten effective treatment and their symptoms have since gone away, there should not be a negative consequence on their body now. So they should be in the clear. I hope they can rest assured that if something worse was going to happen, it would have happened during that prior period of time.
Thank you.
Mhm.
Instagram viewer, and sorry, Instagram viewers, nobody uses their name like they do on the YouTube chat, so that's why I don't say it, because there's usually a lot of letters and numbers. I'm 64. I had a stroke a year ago. Can I start on estrogen?
Yeah, I mean, again, this is a great question, and definitely, you need to make sure that you're using all the blood thinners for stroke prevention, and of course, you should talk to your neurologist. But yeah, I mean, in theory, right, a transdermal preparation of estrogen is not associated with increased risk of clots, right? So in theory, someone with your history who's using a transdermal estrogen patch or estrogen gel can safely take that type of HRT after having a stroke.
Thank you. And
Mhm.
another, the Who's It is asking, is diminished libido and orgasm after menopause related to cardiovascular issues or testosterone levels?
It can be both. Yeah, it can also be due to estrogen levels. So what we find is that, you know, if if you don't have enough estrogen in your body and your body does not respond to the physical and mental cues by becoming lubricated and aroused and excited, then that can have a negative feedback on your desire. Okay. So let's say you're using your estrogen and you still have low desire. That would be a great time to consider adding testosterone to your regimen. There is a meta-analysis, a Cochrane meta-analysis, which means like this very important group, this very important uptight group that is very rigorous with data, aggregated all the information and determined that testosterone therapy for women who are postmenopausal is helpful for low libido. So what I'm saying is there's excellent evidence for this. It is not woo-woo. It is not fringe. It is very established to use low doses of testosterone for women in menopause for low sexual desire. So that is a very important option. And then of course, if you have difficulty with sexual arousal and responsiveness, it's always important to, as I mentioned kind of off the top of this episode, just talk to your doctor in general about screening for cardiovascular disease risk factors, right? Like, what is your exercise tolerance? Do you get short of breath with activity? When was your last diabetes screening? When was your last lipid panel screening, right? All of these things are important for your best health and your best sexual health.
Perfect. Thank you.
Mhm.
The name is Y White 1966. My niece uses pellets for hormone replacement. Would you explain that? So that's just that's like the Uvafem, right?
So there are intravaginal inserts like Uvafem, and then there are people that do, right? And Uvafem, like the intravaginal inserts, are the same as like vaginal estrogen, right? It's the low dose treatment for the vaginal symptoms. Now there are some people who use pellets, like inserted usually in the butt, for hormone replacement therapy to raise the blood estrogen and testosterone levels. Okay. It's tough, right? Because there are no pellets containing estrogen inserted that way that are FDA approved. So generally, when you're using one of those, it's compounded. That's neither here nor there. It's just important to know that the quality control metrics are not as robust when you obtain it that way. So sometimes there is less control over the end result in terms of blood hormone levels, right? And so you have to do this with a provider who is educating you about the difference between FDA approved and the compounded options. Yeah, and just be careful. I mean, personally, the main reason I would use a pellet would be just for testosterone in women or men. There is an FDA approved testosterone pellet. There are no FDA approved estrogen pellets. The testosterone pellet, you could potentially use, but is not the first thing you would use. You would start with a gel, for example. So yeah, it's definitely not the first line. And I do hope the person who is using the pellets has been offered other types of HRT first, to see how they responded to that, because
Right.
the pellets you can't get out once you put them in.
There's a question, and you've already addressed this, is there a relationship between HRT and dementia risk? And you told me before we logged on that it actually that it improved it, right? Not did.
Yes. Women who are on estrogen after menopause have a lower risk of getting Alzheimer's. So
Well, that itself might be worth it to go on,
I know, I know, I know. This is what I'm saying. Regardless of your vagina, I mean, for your brain and for your bones, like,
Yeah. So Karen says,
right?
what if you stop taking HRT when you were in your 50s? Can you start it up again at 73 to protect against osteoporosis?
Yeah, so this is a very complex issue and one that you definitely want to talk to your doctor about. Um, there are more risks if you have stopped it and you are restarting it. Um, you know, yeah, I mean, I'd say in the ideal world, you start it during perimenopause or soon after menopause and you just stay on it. There are some increased risks when you stop and restart, particularly from the cardiovascular disease standpoint. So I believe when we look at risks associated with estrogen therapy, there's a higher risk of cardiovascular events if you start it later after menopause. But again, definitely something to talk to your doctor about. It's not out of the question, but it's less standard.
That's interesting
Yeah.
that's yeah. Okay.
Then this is why I want to talk about this stuff so much, because we shouldn't be in a position where people are getting in that, are having regrets about having stopped it. Like we do so much fear mongering and then people aren't taking it because we scared them without giving them enthusiastically the information about the benefits.
Right.
Um,
Renee
yeah.
says, I do the estradiol insert twice a week. What kind of testosterone should I start with? And do you do telehealth? I mean, I'm sure people would love to see you if in the states that you practice in.
Yeah. It's a great question. At this exact moment, I am not, but I am setting up a practice actually with a friend, and I will post about that on my social media. So please follow me on Instagram. I'm Ashley G. Winter, AShleyGWinter, and I'm also at Ashley G. Winter on Twitter. And definitely when I get things up and running, I'm kind of in a transitional phase right now, but when I get that up and running, I will announce it. I am licensed in California, Washington, and Oregon. So if you are anywhere on the West Coast at all, I definitely will be able to have an appointment with you through telehealth.
If
And
you
of course, if you came to California, then I could see you in person.
oh, could you
But
could you please remember to tell me when that information is available? Because the show notes, this will stay on YouTube. I can't promise them on the other
oh,
places.
sure.
And then I can amend them and say, what that information is right when you have it.
Yeah, I would love to. Yeah. Thank you so
Man,
much.
yeah, it would be so fun to have you and Dr. Rubin and Dr. Casper
Yeah.
at a conference on a panel. Well, thank you so much for your time. I know
Yeah.
but this is important information. And,
Yay.
besides my little community of several hundred people that come every day, we call them the Zoomunity. They're the ones that watch on YouTube. And now we have viewers also on Facebook, Twitter, and Instagram. Other people will see this video and maybe get the help that they need for the area that we love to call down there.
I love it. Well, again, thank you so much for amplifying these topics. Thank you to all your listeners and viewers for being fearless enough to raise their questions. Sexual health is health. Your genitals are just part of your body. We deserve to be healthy and happy and intimate and satisfied no matter what age we are. And I hope everybody is able to achieve and accomplish those goals and find somebody who is able to help you do that.
All right. Well, thank you so much, Dr. Winter. This was
Yeah.
really interesting. I really appreciate you and the work you do.
Yeah, you're so welcome.
And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at 9 a.m. Pacific time for The Doctor is In Q&A with Ron Weiss, MD. Take care, everyone. Bye-bye. I actually have to end the show twice because you got to do a special thing for Instagram. So I'm still here, but I'm going to say I know I don't know how to make it. Instagram doesn't make it easy for us to stream there. It's primarily YouTube. So,
yeah.
just You know, Dr. Winter, we're still alive, but I don't know how you feel about balsamic vinegar, but every guest gets two. I don't say this often enough. Thank you, Thomas. We have the show, a little show has a sponsor. California Balsamic makes, in my
Ooh,
opinion, the most delicious, sugar-free, oil-free, salt-free balsamic vinegar. Not that it would have that, but sometimes it has sugar. And you're going to get to choose two flavors in the flavor of your choice. And that's our little gift for you for being on the show. First time guests only.
I love it.
See, all right. There's one lady, I don't want to say her name. She's a well-known doctor that she says the only time she'll let me be, she works for vinegar, basically. That's how much she
That's
loves it.
so funny.
I hope you enjoy
I'm
it.
excited to try it. I love
Hey,
vinegar.
I hope I get to meet you someday. You never know. I was
Yeah,
actually in LA
totally.
last weekend, but I didn't know you yet. Thanks so much,
Oh
Dr.
yeah,
Winter. Take care.
totally, of course. Well, I'm so glad Rachel put us together. She's a
Me too.
connector.
Yeah, you guys are great.
So
I'm really
yeah.
admire. I wish they had doctors like you when I were, I have them now. You're just not in my area. So
Yeah, yeah, totally, totally. Well, yeah, and anytime I'm happy to come back. So
absolutely,
yeah,
absolutely.
yeah,
Maybe
let me
when you
know.
got your little device on the market,
Yes, definitely, definitely.
that would be a fun
I
show.
love it.